Okay, good evening, guys. I've got discussion C for you. We're discussing concise summary of the main points from the page on palliative and hospice care. Core themes. Palliative care's role goes beyond creative medicine to provide physical, emotional, social, and spiritual support to individuals with serious or terminal illnesses. Holistic and interdisciplinary approach emphasizes collaboration between healthcare teams, families, and our families, healthcare teams and families to improve the patient's quality of life and offer bereavement support even before death. Societal neglect of end of life needs. There's a cultural tendency to avoid give me 1 second. Discussions about death, leaving gaps in support for patients and their loved ones. Global call to action. The 2014 WHO resolution urged governments to integrate palliative care into national health systems and improve access to necessary treatments like morphine. Progress and challenges. Advances since 2014. Some improvements in training policy and awareness have been achieved. Remaining gaps. Access to education and systematic integration of palliative care remain insufficient globally. It's a powerful reminder that compassionate end of life care isn't just a medical necessity, it's a moral one. Would you like, give me 1 second, guys. Would you like to explore these ideas connected to your work and caregiver education or ethical decision making in frailty aware care models? Integration of palliative care into national health systems is a multifaceted process that reflects both ethical imperatives and practical strategies. Here's how it's typically approached. Core strategies for integration. Policy development. Governments create national policies that embed palliative care into broader health strategies, such as cancer control, aging, or chronic disease management. Primary care inclusion. Palliative care is increasingly offered at primary care level, allowing general practitioners and community health workers to deliver basic symptom relief and emotional support. Education and training. Health professionals across disciplines receive training in palliative care principles, including pain management, communication, and end of life ethics. Access to medicine. Policies ensure availability of essential medications, especially opioids like morphine for pain relief, often requiring regulatory reform to overcome barriers. Service delivery models. Countries adopt models such as consolidative teams, integrated care within hospitals, and community-based services to reach patients across settings. Monitoring and evaluation indicators are developed to access integration process in areas like pediatrics, long-term care, cardiology, and volunteering. Global perspective. World Health Organization resolution WHA 67.19 2014 declares palliative care a core component of health systems and an ethical responsibility, urging member states to integrate it into universal health coverage. Low and middle income countries. These regions face the greatest need and often the steepest challenges, prompting tailored strategies for community-based and culturally sensitive care. Example indicators used in integration. Domain, sample indicators, source. Pediatrics, availability for pediatric palliative care services. Primary care, training of general practitioners in palliative care. Long-term care integration into nursing home protocols. Cardiology palliative care pathways for heart failure patients. Volunteering role of trained volunteers in service delivery. Would you like to explore how these integration strategies align with frailty-aware care models or memory-friendly housing design? I think there's a fragmenting palliative is a welfare, integrating palliative care into health systems has profound and multifaceted impacts clinically, emotionally, and socially, and economically. Here's a breakdown of key outcomes: patient-centered benefits, improved quality of life, integrated palliative care, IPC, significantly enhances physical, emotional, and social well-being, especially for cancer patients. Reduce psychological distress. Studies show notable reductions in anxiety, depression, and PTSD symptoms among patients receiving IPC. Better symptom management. Pain, fatigue, appetite loss, and insomnia are more effectively addressed through coordinated care models. Enhance coping and self-management. Patients report stronger coping skills and essential resilience when palliative care is introduced early. Family and caregiver outcomes. Higher satisfaction. Families express greater satisfaction with care processes, especially when involved in decision making and emotional support. Reduce caregiver burden. IPC helps integrate stress and depression and mitigate stress and depression among caregivers by offering structured supports and communication. System level impacts. Resource optimization. IPC reduces unnecessary hospitalizations and emergency visits, promoting more efficient use of healthcare resources. Goal concordate care. Patients receive care that aligns more closely with their values and preferences, especially near end of life. Workforce well-being. Interdisciplinary collaboration fosters better communication and morale among healthcare teams. Advanced snapshots. Impact area. Key findings. Source. Quality of life. IPC improves quality of life, especially significantly versus standard care. SMD equals 3.25. P equals 0.001. Psychological health lowers anxiety, depression, and PTSD scores in IPC groups. Family satisfaction. Higher satisfaction with care and involvement. Healthcare effectiveness. fewer hospitalizations, better symptom control. Self-management, improve coping and preparation strategies. These impacts reinforce that palliative care isn't just a compassionate add-on. It's a strategic, evidence-based intervention that transforms how we care for people facing serious illnesses. Would you like to explore how these findings could inform frailty aware care models or caregiver training frameworks? I think there's a rich potential for application in your work. Scanting overlap with your work on systematic reform and ethical caregiving, integrating palliative care into healthcare systems reshapes how care is delivered clinically, economically, and ethically. Here's how it influences the broader system. System level transformation. Continuity across settings. Integration ensures smoother transitions between hospitals, clinics, and home care, reducing fragmentation and improving patient experiences. Reduced hospitalization. Patients receiving integrated palliative care are less likely to undergo unnecessary emergency visits or intensive interventions, easing pressure on acute care services. Cost effectiveness. By focusing on the symptom management and aligning care with patient goals, systems can reduce high cost procedures and optimize resource allocation. Workforce collaboration. Integration fosters interdisciplinary teamwork. Improving communication and morale among providers while enhancing care coordination. Structural and policy impacts. Policy development. Countries like the UK and Australia have adopted national strategies that embed palliative care into broader health frameworks, influencing funding, training, and service delivery. Primary care empowerment. World Health Organization advocates for palliative care at the primary level, enabling general practitioners to manage basic needs and refer complex cases appropriately. Technology integration. Telehealth and AI tools expand access, especially in rural areas, and helping systems manage workforce shortages and caregiver burden, ethical and cultural shifts, patient-centered models. Integration promotes care that respects individual values, cultural preferences, and emotional needs, especially critical in end of life scenarios. Equity and access. Integrated systems are better positioned to access uh, discrepancies in care, particularly for underserved populations and those with non malignant conditions. Would you like to explore how these systematic shifts could inform frailty aware care models or memory friendly housing strategies? There's a rich intersection with your work on ethical caregiving and autonomy. Integrating palliative care into healthcare systems yields a cascade of specific benefits clinically, emotionally, and economically. Here's a detailed breakdown: clinical and patient centered benefits, enhanced quality of life. Patients experience significant improvement in physical, emotional, and so, uh, social functioning. Better symptom control. Pain, fatigue, and anxiety and depression are more effectively managed through coordinated care. Uh, Psychological resilience. Integrated models foster emotional stability and reduce distress, especially in advanced cancer patients. Folks. Spiritual and existential support. Patients receive care that acknowledges their values, benefits, and end of life reflections. Family and caregiver advantages. Higher satisfaction. Families report greater contentment with care processes and communication. Uh, Bereavement support. Integration includes anticipatory grief counseling and post loss support, easing emotional burdens. Improve family involvement. Structured care models encourage active participation in decision making and caregiving. Systematic economic impacts. Reduced, reduced hospitalizations. Integrated care lowers emergency visits and ICU admissions, easing strain on acute services. cost savings by avoiding unnecessary interventions. Systems optimize resource use while maintaining compassionate care. Workforce well-being. Interdisciplinary collaboration improves morale and reduces burnout among healthcare providers. Evidence snapshot. Benefit area. Key findings. Quality of life, IPC, significantly improves. Quality of life versus standard care, SMD. Mental health lower anxiety and depression scores in IPC groups. Family satisfaction, higher satisfaction with care involvement. Healthcare effectiveness, fewer hospitalizations, and better symptom control. These benefits aren't just theoretical, they're backed by rigorous studies and real world outcomes. Would you like to explore how these findings could inform frailty aware care models or caregiver training strategies in your work? I think there's a rich potential for application. Absolutely. The benefits of integrated palliative care offer a rich foundation for transforming caregiver training strategies, especially in frailty aware and memory friendly environments. Here's how we can translate those systematic and emotional gains into practical, empowering education for caregivers. Training enhancements inspired by palliative care integration. Symptom management and emotional resilience. What to teach. Pain relief techniques, fatigue mitigation, and anxiety reduction strategies. Why it matters. Caregivers equipped with these skills can respond confidently to distressing symptoms and reduce emergency interventions. How to deliver. Use simulation-based models and real-world case studies to build confidence. Communication is shared decision making. What to teach. Techniques for values-based conversations, advanced care planning, and navigating family dynamics. Why it matters. Enhances trust, reduces conflict, and ensures care aligns with patient goals. How to deliver. Role play scenarios, guided reflection, and decision tree exercises. Bereavement and existential support. What to teach. Anticipatory grief counseling, legacy building activities, and spiritual sensitivity. Why it matters. Supports caregiver and emotionally, and prepares them for transitions. How to deliver, integrate mindfulness, journaling, and peer support circles, care coordination and continuity. Okay. What to teach, navigating transitions between care settings, medication, tracking, and interdisciplinary collaboration. Why it matters, reduces fragmentation and improves outcomes. How to deliver, interactive flowcharts, digital tools, and team based learning. Cultural competency and ethical sensitivity. What to teach, respect for diverse beliefs, autonomy and dignity at the end of life care. Why it matters, promotes equity and personalized care. How to deliver, storytelling, cultural immersion, exercises, and ethical dilemma workshops. Strategic framework for implementation. Palliative care benefits, caregiver training strategies, outcomes, goal, improved quality of life, teach symptom relief and emotional support, confident, compassionate caregiving, reduces hospitalizations, train in early intervention and care coordination, fewer crises, and smoother transitions, enhanced family involvement, empower shared decision making and communication, stronger family caregiver alignment, workforce well being, fosters peer support and interdisciplinary respect, lower burnout rate, or lower burnout, higher morale. Okay, last page, guys. Would you like to co-design a sample training model that blends these elements with your work on memory-friendly housing or frailty-aware care? I think it could be a powerful blueprint for systematic reform. Okay, guys, so that is it for tonight. See you guys tomorrow for shows. For now, Gator Wellness, take care, folks.